My name is Dr. James DeBloom.
And I'm Dr. Camille Mason DeBloom. We're both fellows in the American College of Mohs Surgery. This means that we both completed a residency and board certification in dermatology and then went on to complete an additional fellowship in Mohs surgery and facial reconstruction. Currently, there are only 900 fellowship-trained Mohs surgeons in the world.
We would like to discuss a few components of the Mohs surgical procedure that you're scheduled to have today. Mohs surgery was named for Dr. Frederick Mohs, who pioneered this important technique for removing skin cancer. Mohs surgery is a state-of-the-art technology that allows the surgeon to visualize the complete size and the shape of your tumor. This is important for many reasons. Often cancers have root-like projections that cannot be seen with the naked eye. These roots are only visible under the microscope. If these roots are not completely removed, then your cancer will grow back, often with a worse prognosis. More standard treatments such as surgical excision, scraping, burning, freezing, or topical chemotherapy creams can leave these cancer roots behind and result in an overall worse prognosis.
In addition, being able to visualize the tumor and track these root-like extensions allows the surgeon to remove an overall smaller area of skin while still ensuring that the cancer is being completely removed. You can understand why this would be so important in extremely cosmetically sensitive areas, such as the eyelid, nose, or lip. But even for those of you lucky enough to not have a skin cancer in one of these sensitive areas, removing less tissue will shorten your healing time and reduce your risk of complications.
We will start our day by drawing a line around the part of your cancer that can be seen clearly with the naked eye. This is our starting point and serves as the border of what will be removed in your first layer of surgery. This specimen will then be sent to the lab to be processed for microscopic evaluation while you head back out to the waiting room. The work of processing the cancerous tissue and evaluating it under the microscope can take from 1 to 2 hours, depending on the size of your tumor. For patients with melanoma, more extensive antibody testing is performed, and the lab work can take 2 to 3 hours to complete.
It is important to realize that only the visible portion of your tumor is removed in this first layer. 60% of the time, just this first single layer is all that is required to obtain a cure. 40% of the time, a root of cancer growing off from the central area is seen under the microscope. The exact position of this root is graphed and marked. Once this root and its location have been found, you will be brought back to a procedure room for an additional layer of skin to be taken at the position of the root. It is important to recognize that this is not a treatment failure or bad news. This is simply the revelation that your skin cancer has a rooted growth pattern and will require some additional work in order to be removed precisely and completely. True bad news would be not seeing these cancerous roots, allowing them to grow and expand in your body. The additional specimens taken are then evaluated in the lab the same way as the first layer, and the procedure is repeated until no cancer is seen at any borders or edge. Essentially, Mohs allows us to visualize the entire margin or edge of your cancer to assure complete removal. On average, it takes 2 to 3 layers to completely clear a typical cancer.
Because the roots are invisible, we cannot see them with our eyes. We know in what direction they are growing, but do not know how far or how wide. Therefore, the methodology of Mohs requires that we move out in 2 to 3 millimeter layers of skin, repeating the process over and over until we are finally around the cancer. There is no way to know how far your cancer has grown, and therefore there is no way to know how many layers will need to be taken today. That is why we ask for you to be available all day, because there is no accurate way to predict the final growth size of your cancer. We want your cancer to be gone and for you to be able to go home as much as you do. So please know that we are working efficiently and precisely on your behalf. Your physicians will take no lunch breaks until the job is done. Our office never stops until everyone's cancer is gone.
99.4% of our patients will never have a recurrence of this cancer again. This means that 99.4% of the time, your cancer is cured in this location of your body for the rest of your life. This also means that there is a 0.6% chance that your cancer may grow back. This is an extremely unlikely scenario, but in the event that you notice any growth and/or bleeding at your surgical site, months to years from today, please see Dr. DeBloom, myself, or your dermatologist immediately.
For most people, the hardest part of the day is the waiting. Many times people become frustrated and start asking questions.
Are you going to get it all this time?
How many more layers are we going to have to take?
When do I get to go home?
We understand the difficulty of the waiting process and empathize with your uncertainty in the midst of all of this. Just remember that the whole point of the Mohs surgery process is the complete removal of the cancer with minimal loss of skin. As I mentioned earlier, the roots to your cancer cannot be seen. They are invisible, but extremely dangerous. If we take an extremely large piece of skin, we would decrease the total number of layers to be taken, but greatly increase the size of your wound. A larger wound takes longer to heal and requires more extensive stitching procedures. Please be patient. Giving us a few more hours today will save you from weeks to months of recovery and could save your life.
Once your cancer has been completely removed, you will be brought back again into a procedure room to discuss how to heal the wound. Most of our Mohs surgeries require some form of stitching. A variety of facial, trunk, and extremity surgical techniques will be available, including stitches, staples, flaps, and skin grafts. Oftentimes, wounds do not require stitches and can simply heal on their own, a process called secondary intention. We will work together to decide what type of repair or healing technique will work best for your particular wound.
Again, welcome to our office. If you have questions, please feel free to ask us throughout the day. I always say that if you have to spend some time in a doctor's office, we want this to be the best possible experience for you and your family. We know there are 100 other places you would rather be today, so we will work hard to make today as relaxing and straightforward as possible. Thank you for your attention. Someone will be with you shortly.